Movement and mobility is so important in the thoracic spine and the hips during the golf swing. If either of these are lacking, you're going to increase some stress on the structures of your lower back and be at risk for injury. So I'm going to show you 3 of the 12 tests I use to assess golfers and their movement. These 3 are specifically focused on the thoracic spine and the mid-back to make sure those are moving well. So the first one is a pelvic tilt. So you're going to kind of get in a golf posture, like if you're going to hit a 7-iron shot, you're going to cross your arms on your chest. We're going to work on trying to tuck the pelvis under, going into a posterior pelvic tilt, and then we're going to kind of stick the butt out and go to an anterior pelvic tilt. And we're just going to kind of go back and forth between these positions. So it would be a failed test if there's a little bit of like shakiness to the movement, or if you don't have the coordination to go back between those positions easily. And we know that this is an important thing in the golf swing. Through 3D analysis, they've shown that we do get a lot of that anterior pelvic tilt as we're coming down through the swing. So it's very important for both performance and injury prevention. Second one is pelvis rotation. So same thing as before, we're kind of getting that golf posture, and I'll look towards you so you can kind of see this a little bit better. We're going to cross our arms on our chest. We're going to rotate just our hips, keeping our shoulders square and pointing straight ahead. Again, there's a lot of rotation in the golf swing, so we're just checking to make sure that we have the coordination and the mobility to be able to rotate at the pelvis. It would be a fail if the individual kind of sways their hips side to side to be able to get that rotation, or if they lack the coordination to do that movement. And the third one is just the opposite. So our hips are going to stay still, and we're going to rotate our shoulders. So we're going to rotate the shoulders as the pelvic stays still. And this one would show a dysfunction if we're unable to keep the hips still as the thoracic spine rotates, or if we lack the coordination to rotate about 45 degrees each direction. Try those 3 movements out and see if you have any difficulty with those. If you have any difficulties with those 3 movements or want a full physical assessment for golfers, hop on over to my website and schedule your visit today.